I would like you to think and put yourself in the month of November. November has this new fad where they think that it's pretty cool for no shave November. Have you ever been with your loved one and rubbed your arm or your cheek up against them and pulled back because you were afraid you might start bleeding? Because unfortunately, they're participating in No Shave November. Well, today I'd like to talk to you about how you may be able to resolve that situation and maybe not have to worry about November coming up next year. There are many different ways in which people do hair removal. There's shaving, cream, waxing, epilator, plucking, laser, and electrolysis. Many people don't understand what electrolysis is. Electrolysis is something that has been around since the 1800s. It was created in 1875 by an ophthalmologist who was trying to cure his patients of ingrown eyelashes. I don't know about you, but that sounds quite painful to me, especially thinking about the technology back in the 1800s. So why would he do that? Why would he try to get rid of hair? How did he do that? What is the science behind electrolysis? Essentially, it all boils down to a very little small electric current that is transmitted by a fine, tiny, sterile little probe directly inserted into the follicle in the opening of the hair, which destroys the germinative cells, dehydrates the bulb, cauterizes the blood supply, and allows you to remove the hair. That's it. Sounds pretty simple, right? Does it actually work? Absolutely. I am a living billboard of how electrolysis works. I have had it done from the top of my head, well, eyebrows, all the way down to the tips of my toes. Yes, I did my toes. Can't have hairy toes with sandals on the beach. Electrolysis is the only 100% approved by the FDA method of permanently removing your hair. So some people are thinking, okay, well, is all electrolysis the same? Because you can go from somewhere in New York down to Texas, over to California, and there are many different electrologists out there who treat in many different ways. There are three primary ways of removing hair through electrolysis. There's galvanic, which is a chemical reaction. There's thermolysis, which is the short wave that produces heat. And there's blend, which is a combination of the two methods. They do all result in permanent hair removal. The original method of removal is galvanic. Galvanic was invented in the 1800s and it's extremely slow. It provides an electric current which turns the salt water in your body into lye. Lye will then decompose the follicle, allowing the hair to be removed. So there is a chemical involved. It's a naturally occurring chemical in your body. However, it also does pass a DC current through your body, which could potentially be dangerous for certain medical conditions. The most common method today is thermolysis. And thermolysis is the method that I do tend to use in electrolysis. It was created in the 1920s, and it's very, very simple. Step one, you've got the hair. Step two, you insert. There's a zap of within 1/100th of a second of work. And then step three, the hair is pulled out and it's gone. So it's very, very localized heat, and it's very similar to a miniature microwave that is inside the follicle. Then the third method is blend. And blend is somewhat common, but not quite as common as thermolysis because blend is using the original galvanic method, so it is extremely slow, up to 30 seconds per follicle. But then at the very end, it uses thermolysis anyway. The original machines, back in the day, they used a very, very slow current during that time. It took the full 30 seconds to get that 5 megahertz through. Then, back in the middle 60s, 70s or so, they bumped it up and got stronger at about 13 megahertz. And then today, we're much stronger now with our machines and our technology, up to 27 megahertz. It's really, really quick in thousandths of a second to get that zap through there. So have they evolved over time? Absolutely, thank goodness, because I can't imagine trying to have my legs worked on by a machine built in the 1800s. So there the 1900s, the first commercial machines came out. And these machines were finally ones that you could get on the market, and barbers used to do it and things of that nature before it got regulated. And then in 1908, the multi-probe machine was created, where they would put multiple probes in at once and zap you all at the same time. That sounded a little bit scary to me as well. Then you move up to the 70s and 80s, and you start getting the computerized machines. And those machines start becoming more portable, and they have transistorized timers in them where you can time the current to a much more precise way. And then you get to today, and then we have touch screens, and we have videos, and you can point to the body part instead of having to calculate everything. And it's up to 6 times faster than previous hair removal devices. We also have other equipment. We have the tiny, tiny probe. I know a lot of people are scared of the word needle. Needle can be a little scary. It's not really a needle. It's a little hollow tube that is so tiny we use a magnifying lens on our faces to be able to see the probe. And we just insert it right in there, and we make sure to use sterile, disposable, insulated, one-time use probes. One time being one treatment, not one per hair. That would take forever. So you want to make sure that when you are going to a facility and doing your research that they use disposable probes. You don't want a probe that was used on the neighbor that just happened to walk out. Is electrolysis right for me? A lot of you are thinking, oh, I don't know. I have this issue, I have that issue, I've heard about this, or I've heard about that, or I have this color skin. Electrolysis will work for anyone. The most people that actually do participate in electrolysis treatments are people that have a hormone imbalance. And those are people, typically women, who have a syndrome called PCOS. It's polycystic ovarian syndrome. This syndrome is an imbalance in your hormones. It can cause many, many different types of issues that women would have to deal with. However, one of those is growing hair in a male pattern. And then you start seeing the ladies at the stoplight, they pull out their tweezers from the glove box and they're going like this in the mirror and they start plucking their chin. You know, either you've seen it or you've done it. Exactly. So a lot of women will come into the clinic thinking that they're completely alone and they're the only woman on the planet that all of a sudden has this chin hair coming out they didn't have before. Well, guess what? You're not alone. It's a very, very secret that we all have and we all like to hide and don't even tell our husbands about most of the time. So what we do a lot of the time is we'll have clients that come in and they're very, very embarrassed about it and they're very, very concerned. And so there was a woman that came into our clinic and she would not make eye contact. She was looking down, she had a scarf on her face, and she said that she had a problem and she was hoping that we can help her. We were able to begin treatment on her, of course. And I noticed a couple months into her treatment, she came in and something was very, very different about her. And I looked at her, couldn't figure it out. And then I noticed she was looking at me in the face and she didn't have a scarf on. Previously, she would always wear a scarf to hide the hair that was growing here because she was too embarrassed to look somebody in the face and to not have clothing covering up the hair. And she walked in that day with her shoulders back, her head held high, and a smile on her face because she wasn't embarrassed to look in the mirror anymore. So women with PCOS and hormone imbalances tend to also grow hair in other areas of our body and are concerned about whether or not that can be treated. Or, I'm pregnant. Can I have hair removed when I'm pregnant? Because we all know that during pregnancy, the hormones tend to go a little crazy, which will cause your hair to change. It can go from straight to curly, it can go from dark to light, it can go from short to long, and it can all of a sudden start growing out in places that it hadn't grown out before. Yes, you can absolutely have electrolysis done when you're pregnant. We just recommend that you do not do it in the areas of the abdomen, the bikini, and the breast. You can absolutely do the face, underarms, legs, all of that nature. Another question that happens quite often is, can men have electrolysis done? Because most of the time they're like, that's for girls. I don't do that. And then they quietly tiptoe into the electrolysis clinic and they come in and they say, can you take care of these earmuffs that I've got going on? So think about standing at an event and looking at the gentleman next to you and thinking, wow, Can you even hear what I'm saying through all that hair? There's also men that come in and they'll get the center of the eyebrow done. We shape the beard where the hair here and the hair here is removed, and they have the nice, perfect shape. And we also have gentlemen that'll come in and have the nape of their neck done. Absolutely. One of the other big questions is, I have dark skin. I can't have hair removal done. That's actually inaccurate. Laser tends to not be as successful with the dark skin, but electrolysis can treat any color skin. And unfortunately, with that skin, there tends to be a very curly follicle where the hairs are going in on themselves. And it causes a lot of damage. You can see a lot of discoloration on the skin. It's very, very hard to shave. It's very aggravating. It's hard to wear a necktie. It's hard to wear a collar. It's hard to look at your colleague and wear makeup and get it to wear flat because you have all of this damage going on. We can absolutely take care of the hairs that are bothering the people during that time. Another avenue of hair removal is athletes, professional athletes. The professional swimmer, they're trying to get that extra few seconds taken off of their time while they're going through the water, and they don't need this hair dragging them while they're dragging them down in the water. And you know those guys are shaving their chest before they go out to the beach. The other athletes would be bicyclists. They tend to want to have that extra time. You have wrestlers who don't want somebody grabbing onto that arm hair, trying to pull them down to the mat. So we can absolutely help that. Another group of people that need electrolysis is the teenager. Puberty is a crazy time in a child's life, and then all of a sudden, not only do hormones go crazy, but all of a sudden the hair starts coming out. And your poor daughters are all of a sudden growing a dark mustache on their upper lip. They start realizing through puberty that they started developing PCOS. Well, I had a client come into my clinic, and she was a young lady in high school. She was a freshman in high school. She had a full beard. And you know how hard high school is. So we were able to treat her and take care of her and make sure that it was completely gone before she went off to college. Another very large community that we're working with is the transgender community. There is a lot of gender dysphoria within that community. I have a client who has actually become an electrologist who has gone through the transition and had to remove the full beard that she has had her whole life. And so there's the stages of the thick full beard all the way to the clean face and the smile and the chin held high, because she is able to present herself to the world in the way that she believes she is. So a lot of people are concerned, like, I don't know, is electrolysis or laser? So you need to know your options. Electrolysis and laser are very, very similar, but laser is a little bit more popular because they have a much higher advertising budget. Laser tends to be in the Sona Med Spas and all those things. They have these great big advertising budgets. Electrolysis is generally a one-woman-owned shop or one-person-owned shop, and they don't have the competition. So electrolysis has been around much longer than laser. It's just not as widely well known. So what to expect from electrolysis? It works. It destroys the hair follicle so that it doesn't come back, and it can be used on any color skin, any type of hair, anywhere on your body to a very, very fine point. The benefits are it's permanent, that it can inhibit hair growth, and it can do the shaping of the eyebrow. It can work on the upper lip. It can get that one hair on that pesky mole that you got right there on your chin that you've been hiding like this. There are some side effects. They are all temporary. You're getting a clinical medical procedure done. You're going to have a side effect. There's a little bit of redness, a little bit of swelling. Sometimes there's a little bit of scabbing. It all will go away over time. Your skin will heal. What to expect from laser? Laser uses heat and light and radiation to damage the follicle and get as deep as it can. And it is longer lasting than most home remedies, but it is not necessarily 100% permanent. There are many people that do come back because laser did not work for them. Some of the side effects, one very, very, very big side effect is paradoxical hypertrichosis. It's a big word. All that means is you're gonna grow more hair. There was a woman that came into our clinic and she had laser done on her face, and then she came in and all of a sudden she was growing way more hair than she originally had. We had a gentleman come into our clinic and he had 3 hairs on the upper part of his back. And his wife was getting laser done and the technician goes, "Here, I'll get that for you." And she goes across his back and now he has a strip of hair across his back that he did not have before. You can have color discoloration. you can have scarring and things of that nature. So which is best for you? Electrolysis is the most permanent method of hair removal. The results are permanent and they have fewer side effects. And electrolysis is a procedure that is safe for anyone, anywhere on your body, in any way. So the video is of me doing electrolysis on one of my clients' hands. And it's a very simple, easy method. It is not scary. The probe is so tiny, you can't even see it, barely. And so basically what I want to end with today is when you are looking for an electrologist and you're out there trying to find what's right for you, where you're located, please, 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 please go to a licensed electrologist. And you can find them at the International Association of Electrologists. You can find them at the Texas Association of Professional Electrologists. And you can find them at the American Electrology Association. Unfortunately, the state of Texas is not a licensed state, as many others are, so please try to find a licensed electrologist. Thank you.